I am concerned about the left eyelid dropping. In the picture, it's the right, and the right eyelid healing correctly. I had lower eyelid surgery 3 weeks ago. My left eye seems tighter and more numb than my right eye. It shows more white and droops. Will this drooping get better? The right eye has a bump under it that is slowly changing. Is this normal?
Thank you for your question. You submitted several photos and you expressed in your question that you had lower eyelid surgery done approximately 3 weeks prior and that you're concerned in particular with the appearance and the sensation of the left lower eyelid, where you feel like it looks a little bit more pulled down and you're seeing a little bit more of the inside of the eyelid with the left eye, and you're asking about whether or not this appearance is normal. Well, I can certainly share with you my understanding of your situation with just the photos alone, with the absence of a physical exam. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I am very well known for revision eyelid surgery, and patients come to our practice from all over the world for complications of eyelid surgery, such as lower eyelid retraction and ectropion and things like that, are problems commonly caused or occurring after lower eyelid surgery. So to begin with, this appearance that you have is actually fairly common after lower eyelid surgery. Not necessarily a good thing, but it is an approach that a lot of plastic surgeons and facial plastic surgeons prefer to do, which is an external approach to the lower eyelids. This is called a transcutaneous blepharoplasty. And generally speaking, in my experience of seeing patients like yourself, the surgeon will approach the lower eyelid fat pockets and address everything by making an incision underneath the eyelashes and getting to the fat pockets and then removing some skin with a desire to improve tension in the skin of the eyelid. It is generally, again, my experience that patients will end up with their eyelids being rounded and pulled downward, and in some situations it'll actually evert, the eyelid will actually evert, and that term is ectropion. Now, the reason why it's an interesting question of whether or not it's normal, well, it depends a lot on the philosophy of the doctor who's performing the surgery. In my practice, majority of my procedures I do from the inside of the eyelid, and it's called a transconjunctival blepharoplasty, and it is essentially with my understanding of the approach and my preferred approach to helping people with under-eye bags by working from behind the eyelid and preserving the skin and muscle in the front, which then begs the question, what about the fine lines and wrinkles under the eyes? Well, what we generally do is, instead of trying to remove skin, we actually use lasers and platelet-rich plasma to improve the skin quality. And this combination, for me, has been very effective. And since we do so many of these procedures, certainly with over 20 years experience, I can tell you that the overwhelming majority of patients maintain the position of their eyelid and the shape of their eyes. Therefore, it for me is a preferred procedure. Now, that being said, when patients like yourself have come to my practice very distressed about their appearance, where the lower eyelids you're seeing too much of the white of the eye, and that's referred to as lower eyelid retraction. And if the eyelid is everted, it's called ectropion. And for you, it's not exactly fully everted, but there's a gapping. What I tell those patients is that unless there is an immediate issue related to eye health or integrity, where the ability to close the eye and protect the eye is compromised, you generally should have to wait and allow for some return of muscle function and some degree of elastic stretching of the tissue in order to see if it returns to its better position. Generally speaking, in situations like this, your eyelids will likely at least not evert away from your eyes with time. You may want to look at your before pictures and compare and see how much of the white of your eyes was showing before surgery, and certainly we don't have the benefit of seeing those photos with your question, and seeing what the eyelid position looks like after surgery. Now, it's important that you have this discussion with your doctor. Your doctor and you made this decision to approach the surgery in this particular way, and I'm sure your doctor explained to you what to anticipate. And of course, it is important to maintain the follow-ups. Now, it is, again, necessary to at least understand what is happening, and a lot of times a doctor will recommend, in a situation like this, basically one intervention, and that is upward massage, where you just push the eyelid upward and try to get some stretch so that the eyelid can actually move upward and the scar tissue or healing tissue doesn't pull the eyelid further down. And that's probably the one therapeutic measure that is essentially universally accepted as something that you should do at this stage of your healing process. In the absence of feeling the eyelid and being able to see if it's tethered or stuck, I think that might be worthwhile doing, again, after contacting your doctor and asking about that. So I hope that was helpful. I wish you the best of luck. Thank you for your question.